most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
We're the
therapist.
most famous physical therapists on the internet.
In our opinion, of course, Bob.
Who's this guy, Brad?
But we are very fortunate to have this young man here today. And we're going to tell you all about it in just a second. But
Okay, today we're going to talk about CBD oils. Are there dangers or precautions? And we're going to give you a pharmacist perspective. And this is Chris, the pharmacist, who we are very happy that has joined us. I've been wanting to do this video for months.
Right.
It's been taking a while to get him on board. But
well, he's a busy person.
he's a busy guy. Yeah. So yeah,
Hi, guys.
Again, yeah, Chris, the pharmacist. We've had him before, and hopefully we'll have him many more times in the future. But he's going to give us the real scoop on it, right? But
right.
by
Some
the
real
way,
science. Oh yeah, we got to
get our
back.
channel.
Sorry, Chris, we got to
No
gotta
problem.
cover you up.
I can duck.
This is all the commercial part now. If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. You're also going to want to join us. Go to our website, bobandbrad.com, because we're always giving something away. What it is right now, go to the website, find out.
And they're good things like beds,
mattresses,
right?
and
exercise equipment that is
very cool.
A+.
Want a shorter version of us? Go to the Instagram or Twitter. We got a 60-second version of us. And if you go to Facebook, you also get our giveaways. It's always pinned to the top.
Pinned to the top, yes.
So,
all right.
All I've been hearing about CBD oil, Brad, is that it's good. Like it's a miracle drug.
Right. You're gonna lose weight by it. You can cure your cancer. All kinds of things, and I'm thinking,
depression.
well, it's a CBD oil. Does it look, little bottles like this?
It looks very harmless.
Maybe it's one of those things that can work, but we got to find out what's behind this. So we got Chris here.
So do we want to say what it is first?
Well, I mean, CBD oil is one of the, there's the marijuana plant, and basically it's got about 140 some odd chemicals that come out of it, but the one that we're interested is two that most people are interested in is THC, which is the one that gets you high. It's the one that everybody seems to be all about.
Sure.
But CBD is actually the one that's kind of catching on, and it's an interesting chemical compound because you don't get high from it. And with the new guidelines in your state, and you should probably check with your state's laws and ordinances, but most of it's pretty much decriminalized because the CBD oils that you see everywhere now in gas stations, supermarkets, pharmacies, vape shops, I mean, they all basically come from essentially hemp. And so hemp, by design for basically the laws, can only contain 0.3% THC. So there's no chance that you can get high from it to a degree.
Yeah.
And we say that with a degree because the products that are out there, not everything's what it seems.
Monitored the way
it's the wild west right now, and I think we really I think we have to pump the brakes a little bit. Some of the claims with CBD are a little crazy, and people want to gravitate to something that's going to help. I mean, if you have a problem like anxiety, depression, you want relief for pain from cancer or arthritis or what have you, and actually more importantly seizure control. I mean, I think it really does have applications for patients. So, but we're probably easily 20 years behind the 8 ball as far as trying to get up to date with the research that needs to be done.
Which is interesting because it's been around a long time.
It's been around for thousands of years.
Right, that's what I thought.
So it's not like it's brand spanking new, but I think with the decriminalization of marijuana and the states now legalizing it, I think you're finding that people are gravitating towards alternate routes of healthcare. And I think that, again, there's lots of research that needs to be done. So it's not just a simple cut and dry, try it. I mean, it's something that may work for you, but there's risks associated with it too. I mean, we have to watch it. It can make you feel nauseous or queasy. It can affect your liver, so we do have to be careful.
Now, you mentioned the percentage of that. Can you do that again? Is it? This was a Seizures?
Well, yeah, and there's actually the only prescription CBD product out there is a seizure drug called Epidiolex, and it's used for two very specific seizure disorders, typically in children. And they've, it's right in their safety guidelines. It is a black box warning that says you do need to make sure that you're taking liver tests on these patients. And, from 5 to 20% of patients have had either liver failure or at least liver injury. So with that
what was that?
liver failure, 5 to 20%.
Which is a significant amount.
And that's specifically for Epidiolex, which is a very, very potent prescription version of CBD. So it's not like the products that you're getting anywhere else.
No.
So there's a clear distinction that needs
Sure.
to be made.
Isn't that a topical use, or is
Well,
that oral?
CBD can be ingested in many different ways. You can,
But I mean, for that specific,
for that one, it's an oral medication.
okay,
So
okay.
it's you take by mouth. So from that standpoint, and again, it's a very specific subset of people. So
But yeah, Chris, talk about how people do take the oil.
yeah, so I mean, CBD can be ingested. So let's say you're somebody that has, performance anxiety. If we're going to do something like this, I did not use CBD before we came on.
we
but
better
it's-
test you, maybe.
But and it shows up on tests, so you do have to be careful with that. We can touch on that later too. But let's say somebody's a little bit uncomfortable about speaking, or just an anxious situation, or just has an anxious day. CBD does have a tendency to work for people to help them to kind of feel a little bit more relaxed in some cases. But you should always check with your doctor to make sure it's appropriate for you. So
and like doses, is there any idea what dose to
and
take?
again, remember how I kind of said wild, wild west?
Right.
That's part of the problem is we're really behind in the science that we need to do applicable doses. One interesting study that I read that was probably poor science, but at least showed some results, was a Brazilian study. And there was they just took people that wanted to they kind of did a public speaking simulation. And so they kind of came up with a target dose. So they had about 53 people come through the study and basically set them in a scenario where they had to speak in front of people. So it created that anxiety. So they
Sure.
just
Sure.
didn't quite feel right or comfortable. So they tried varying doses of CBD. And so what they seemed to, and it was an oral dose, it comes out to be 300 milligrams seemed to be the sweet spot. So that seemed to work really well. The interesting thing on the study was that a dose as low as 150 milligrams was useless, and a dose as high as 600 milligrams was useless. But
No kidding.
300 was kind of right in
Yeah.
the middle. So it's kind of an interesting. So that's just one example. It wasn't double blinded, so we didn't see a placebo done with that. So let's say, in my world, a lot of times doctors will prescribe propranolol for people for speaking engagements. It works really well, but it'd be nice to see it get one-on-one,
Right.
just to see what's
Compare
going
the
on.
two.
And I'm sure that there's research facilities out there. And in the university setting, it's a hot topic, but it's hard to come by. So it's interesting that consumers can get it all you want, but the universities have trouble getting it to study it. So
No
it's
kidding.
kind of an interesting conundrum.
So at your pharmacy,
Mhm.
How is it offered?
Well, where I work, it's basically going to be something that's going to be a topical. So it's going to be something that you would rub on to, so it's going to be for pain. It can actually be used for anxiety. It can be used to rest.
So you just rub
there's-
it on your skin.
Yep, and there's also
Non-prescription?
non-prescription right off the shelf.
Right off the shelf.
And then there's drops that you can place underneath your tongue. So we were kind of talking about the ways to ingest it. There's such a wide topic. So you can vape it.
So does it? I'm sorry to cut you off, but what, like when you get it in your pharmacy, does it tell dosages to take it at?
They
Or
have
are
suggested
people going to be reluctant. You're going to just jump in and use it as much as they want.
It's interesting because I kind of looked at some of the products that we carry, and so they have, for anxiety relief, for pain relief, to help you to rest, calms. So they have all sorts of different names and packaging that kind of suggest their uses, and they give guidelines, but there's not a controlled dose, so it's very, very difficult to figure out just how much is enough. And so that's the problem, is we just don't have enough controlled studies, excuse me, that show what we should be dosing it as. So
Are
they'll
these
suggest a
large companies that are offering this that you feel that you can trust at this point as far as the quality of the product?
As a business person, I think they're all trying to get it right. I would imagine that they're all trying to make the best and greatest. So, there's different ways to process it, to extract it, and they're working, to try and make it emulsified so that it absorbs better, more effectively, so that you're getting more bang for your buck. So I think there's a lot of good science that's going into it, but what we need is the science, the research to show proper dosing, proper frequency, minimization of side effects, things that we have to be careful with as far as liver damage, and which is actually a big thing with that. If you're on a blood thinner, it's certainly something that we want to be mindful of, because there is a risk for bleeding out, which is very, very significant.
A lot of people are on blood thinners, so this is
again,
really
So
important for you to know.
if you're on blood thinners and you're considering CBD, you better consult
I would
with your
say
physician.
I would just say no at this point.
Really?
And
It's
just-
that- it's
and
that
well,
cut
you
and
should
dry.
because you just don't know, and we don't know the doses. It varies from batch to batch. There was a study that showed that they took all these samples of products, and only 20% actually had the right amount of CBD in there.
That's what I was wondering.
So there was stuff
Yeah.
that had much too much, there was stuff that had much too little, and there was stuff that had actually a lot of THC in there, which is the active component of marijuana. So, and
There you are,
I
putting
kind of said
yourself at
briefly
risk.
earlier, so putting yourself at risk. You can't
Yeah.
test positive. So, with the decriminalization of it, I think there's a lot of employers these days that may or may not have problems with it. But again, you should check with your employer. You should check with your doctor. I mean, these are things that you really want to be clear on.
Right. If you're in
Sure.
a position that
Right.
that there's no tolerance for it, I mean, maybe a pilot
It-
or something
it-
like that. I mean, you don't want to take a chance.
It could cause problems.
Sure.
So we want to be real careful with that. But again, with your own health too, you want to make sure that it's something that's safe with your medication. So I mean,
So, Chris, how long have you been a pharmacist?
24 years.
So 24 years. Have you seen drugs like this before? That I know I'm putting you on a spot, but like that seems like it's having so much promise, and then all of a sudden, they kind of unveil, take the wrapping off, and they find out, no,
Yeah.
this is not as good as.
I've seen it on the prescription side of things. So there's
Sure.
many things that the FDA is, allowed to go through, and then all of a sudden, as we get into larger scale, more mass people taking it,
Yeah.
they all of a sudden there's acute liver failure. I mean, Vioxx is a very
Yeah,
popular.
I was going to bring up.
So I figure you guys are physical
Yeah,
therapists, so
yeah.
I'm sure you guys remember that
No,
anti-inflammatory.
my mom was on it.
It was a great drug.
Yeah, it was.
But-
it was the drug.
But it
Yeah.
caused cardiovascular problems. So so they pulled it off the market.
So we've seen this before. I mean, it comes out with great promise, and then you realize, you take the veil off.
Yeah, and I think there's times when you have to pump the brakes, and I think
Yeah.
we just need to learn more so that we can help people to hopefully maybe even help themselves. But I think it works well when you have a physician that's on board and is knowledgeable with the products as well, or your pharmacist, or your nurse practitioner, or your PA, or whomever you get your healthcare benefits, or your care through.
Service, yeah.
So I think it's important to make sure that everybody has kind of a team-wise approach to ensure that we can do what's safest for the patient, to ensure that they're getting the safest thing that they can do for themselves. But we just don't even really know real doses, touching
Sure.
on that earlier example I said. So it's
You can
really,
go low,
really
you can go high,
hard.
and it be ineffective, and you got to really find that sweet spot. And so, how do you do that?
And what
I
are the
mean,
dangers if you're taking other prescriptions?
Right,
So
right.
it's something to be, you
all
you
that
want to
interaction.
grain of salt with this one. You want to be super careful with it. But I mean, I think that there's lots of studies that are now showing that yes, it can help you with anxiety and depression. So is it something that we want to embrace? I think it's certainly something that we can reach out for and see if we can help
Sure,
some people.
right.
But again, you want to do it in a very professional setting insofar as allowing your doctor to be in on the care plan. I think that's very, very important. Some people self-medicate, and it's certainly a choice that can be made by themselves. But it's just something to just be aware of the risks. I mean, so you want to make sure that probably if you're going to be a user of it, that you probably see your regular doctor to make sure that they're looking at your liver functioning.
Mhm.
So that's one of the few organs we don't replace well. So it's certainly something, and that's not a joke. I mean, it's
Right.
something that we have to be careful with that because we just don't know these doses. And again, so if you're going to choose something, be consistent. Probably go to the same source, go to the same
Sure.
product, go to the same retailer, because I think from that standpoint, you can always guarantee that you're getting at least the same quality product that your body is adjusted to.
So you mentioned anxiety and depression. Is there any other area that you think this is really showing promise in right now? Or what,
Well, yeah, I mean, if you want to look at specifically medical marijuana, so it's a little bit off topic, but medical marijuana has THC and CBD. So you get the benefits of both. And I
Sure.
think so if you're somebody that's suffering severely from cancer pain
sure.
or glaucoma, or certain, and actually seizure disorders, those three in particular probably show that medical marijuana probably has a real application in all three for very different reasons.
What about CBD oil?
Well, CBD oil will work in all those cases as well,
But
but medical
medical marijuana would
marijuana
be a
specifically,
step above
if
that.
you are a cancer patient and you can't, you're taking something like a very strong prescription narcotic,
Sure.
just throw out fentanyl, for example, or oxycodone, for example, which
Sure.
are buzz topics in the medical world as well. Some people have just found that the medical marijuana provides them better pain relief, and they don't feel as weird from the side effects that the opioids create.
Sure.
So I think from a standpoint of quality of life, I think there's an application, but again, we have to be super careful. We have to make sure that it's legal in your state. We have to make sure that your doctor's on board with it.
We were talking before, Chris, you and I, and didn't you mention there is a CBD oil based prescription that is used for seizures? That's very,
Yep,
you've seen it very effective, and it's
Well,
all
it's
over-
a newer product that came out last year.
That's
It's
the one you were
called
talking about, the liver failure.
It's Epidiolex.
but
Yeah.
isn't it the one that you said it's topical and not?
Nope. There's actually some and we can, for CBD oil and seizure control, there's some incredible videos out there of patients that have had severe seizures, and then they take a CBD oil product, and actually I've seen it applied on a child's feet, and it actually abated the seizure. I mean, it's almost
Wow.
miraculous what it can do. There are applications where they're studying for Parkinsonism, insofar as kind of helping with
Interesting.
the motor movement to try and help with the issues with that. There's some actually, interestingly, topically, they talk about actually its improvement for acne. So, I mean, it's certainly something that can certainly help out. I think the mainstays are going to be anxiety, depression, pain relief, and seizure control are the main ones, but it's got a lot of other claims. I think we have to be careful because there's some wild claims out there that say it may cure cancer. I think
Right.
that's the carrot is way out in front of the horse on
Sure.
that one.
Yeah.
I think with proper medical research, large scale studies, I think maybe we can see some very positive effects that may occur from it, but we still don't know the dangers of it. And and I think what we're going to see when more and more people start to use these products, we're going to start to see a litany of side effects do occur
Sure.
that will
Years
become
down the road.
years, days, years, weeks, months.
Yeah.
I mean, it just kind of depends,
Sure.
because if you report it to your doctor, then they can put it into a database and then they can actually learn from it, so we can do more for people, and
Yeah,
hopefully
learn from experience, especially if someone's been down the road for a long time here. I mean, in all seriousness, I mean, these things start to crop up, so you really
Oh
want to
yeah.
have
Oh yeah.
show caution.
Very much
So,
so. Very much so.
All
And
right.
any other final thoughts?
no, I mean, I think we just have to make sure that we're being careful with our usage of it. I think it may have a place in medicine. I just stress to anybody, if it's an interest that you have, to discuss it with your physician, because I think
That's step one.
that's your first step you want to go, or whoever your provider is. I mean, it's just
Mhm.
something to just, and then, the sourcing of it and the dosing of it. So
Right.
be
It's gonna be very
consistent where
important.
you get it from.
Sure.
And I think there's a lot of knowledgeable people out there that do sell the products. And so it's their life, it's their livelihood. And so they're
Mhm.
going to take the time and care about you and try and provide you with the best product. I don't know that I would necessarily go to your local gas station and buy it, because I don't think
Exactly.
they're going to be the knowledgeable ones. But
That's exactly
when you
right.
go to a
Right.
retail setting or a retail store that does sell these things, I think you can get a little bit more information. Do research on your own too. I think
Right.
there's small volumes of evidence, but be careful with it. And that's why I think it's important to have a dialogue with your physician or caretaker, because they're the ones that can help kind of sift you through what's right, what's wrong. Was it really good data? Are we missing something? We
Yeah.
just want to keep everybody safe. And I think
Right.
that's the most important thing that we can take away from this.
Right.
So once again, we want to thank Chris for taking the time. Man, does this guy have knowledge in his head? or
Yeah,
what? I mean,
it comes
so,
out well.
So,
All right. Thanks, everyone.
yeah, thanks everybody for watching.